In this video, we will explore 10 health issues that may be a reason to stop drinking coffee. While coffee is widely popular and has recognized health benefits, it can have negative effects on the body in certain conditions. Consuming coffee may worsen symptoms or increase the risk of blood clots, varicose veins, irregular heartbeat, stroke, liver disease, or liver cancer. It can also contribute to kidney failure and the formation of kidney stones. Additionally, coffee may intensify inflammation of the pancreas, which is associated with an increased risk of pancreatitis and pancreatic cancer. It can also have adverse effects on conditions such as asthma, osteoporosis, and other health concerns. In this video, we rely on scientific studies and medical recommendations to explain why avoiding coffee might be the best choice for those experiencing these 10 health issues. This video is going to be incredibly informative and helpful. If you want to take control of your health like a pro, give it a like, and let's get started. Number 1, heart problems. Caffeine is a powerful stimulant that affects the central nervous system and has a direct impact on the cardiovascular system. It can pose risks for individuals with heart conditions. Caffeine has the potential to cause irregular heart rhythms and an increased heart rate, which may lead to complications in people with pre-existing heart issues. Regular consumption of caffeine may contribute to the development of coronary artery disease and heart failure, as it raises blood pressure and increases heart rate. A study conducted by the American Heart Association in 2023 found that caffeine can alter the structure and function of the heart muscle, reducing its ability to adapt to physical exertion. Additionally, caffeine can interact with medications prescribed for cardiovascular conditions, either enhancing or weakening their effects. This can reduce the effectiveness of treatment or lead to unwanted side effects. Individuals with heart conditions or those at high risk of developing them are advised to consult a doctor about the need to limit or completely avoid caffeine in order to reduce the likelihood of complications and maintain heart health. Number 2, hypertension. Caffeine can raise blood pressure, which is especially concerning for individuals with hypertension. It stimulates the release of adrenaline, activates the nervous system, and temporarily increases the workload on the cardiovascular system, elevating the risk of a stroke or a heart attack. A study conducted by the United States National Heart, Lung, and Blood Institute in 2024 found that regular caffeine consumption in individuals with hypertension may lead to long-term increases in blood pressure and raise the risk of coronary artery disease, irregular heart rhythms, and heart failure. Caffeine also has a diuretic effect, which can put additional strain on the kidneys and disrupt the body's fluid balance. Furthermore, it may interact with blood pressure medications, reducing their effectiveness and making it harder to control blood pressure levels. Individuals with hypertension are advised to limit or completely avoid caffeine to reduce the risk of complications and improve the effectiveness of treatment. Number 3, circulatory system issues. Caffeine can negatively affect blood circulation, especially in individuals with atherosclerosis, varicose veins, and other vascular conditions. It contributes to the narrowing of blood vessels, which can impair blood flow, increase swelling, and intensify pain in the limbs. One of the most concerning effects of caffeine is its ability to increase blood clotting, which raises the risk of clot formation. A study conducted by the American Society of Hematology in 2023 found that people who consume caffeine regularly have a higher likelihood of developing thromboembolism, which can lead to a heart attack or a stroke. This is particularly dangerous for those with existing vascular diseases such as atherosclerosis, as restricted blood flow in narrowed arteries further increases the risk of severe complications. Additionally, caffeine can worsen symptoms of chronic venous insufficiency and varicose veins. It causes fluctuations in vascular tone, which may lead to blood pooling in the veins, increasing swelling, a feeling of heaviness in the legs, and discomfort. Caffeine can also interact with blood-thinning medications, making them less effective, or conversely, increasing the risk of excessive bleeding. Therefore, individuals taking anticoagulants or those with a tendency toward increased blood clotting should be especially cautious. Based on this information, individuals with circulatory system issues are advised to limit or completely avoid caffeine to reduce the risk of blood clot formation, improve blood circulation, and prevent vascular complications. Number 4, Liver problems. The liver plays a crucial role in detoxification and metabolism. In individuals with hepatitis, cirrhosis, or fatty liver disease, its functions may already be impaired, and caffeine adds extra strain. This stimulant is processed by the liver, but when the organ is affected by disease, its metabolism slows down. As a result, caffeine accumulates in the body, increasing its toxic effects. Research from the American Association for the Study of Liver Diseases indicates that caffeine can intensify inflammation and accelerate the progression of chronic liver conditions. In patients with hepatitis, this may lead to further damage to liver cells, while in individuals with cirrhosis, it can promote fibrosis and the formation of scar tissue, reducing liver function. Additionally, caffeine can trigger heartburn, cause digestive issues, and worsen fatigue, which is a common symptom of liver diseases. Sleep disturbances and increased nervousness caused by caffeine may further impact overall health. Individuals with liver conditions should consider limiting or avoiding caffeine to reduce the strain on the liver and prevent further damage. It is best to consult a doctor before making dietary changes. Number 5, kidney problems. The kidneys filter the blood, remove toxins, and maintain the body's fluid and electrolyte balance. They also process caffeine, but in individuals with chronic kidney disease, this function is impaired, increasing the toxic burden on the kidneys. Due to its diuretic effect, caffeine promotes increased urine production, which can lead to dehydration and the loss of essential electrolytes, further affecting kidney function. A study conducted by the American Society of Nephrology in 2024 found that caffeine raises blood pressure, which is particularly dangerous for individuals with kidney failure. Elevated blood pressure puts additional strain on the blood vessels in the kidneys, accelerating their deterioration. Caffeine also increases calcium levels in urine, contributing to the formation of kidney stones. For those who already have kidney stones or are prone to developing them, regular coffee consumption may worsen the condition. Additionally, caffeine can intensify inflammation, which is especially concerning for individuals with glomerulonephritis and other inflammatory kidney diseases, as it may speed up the progression of these conditions. People with kidney disorders are advised to limit or eliminate caffeine to reduce the strain on their kidneys and prevent potential complications. Number 6, pancreas problems. The pancreas plays a crucial role in digestion and blood sugar regulation, but caffeine can negatively impact its function. It stimulates the production of stomach acid, which may irritate the pancreas and increase inflammation, especially in individuals with pancreatitis. This can lead to painful episodes and a decline in the organ's ability to function properly. Caffeine also increases bile secretion, which can trigger biliary pancreatitis in individuals with gallstones or issues related to the bile ducts. Additionally, it raises oxidative stress levels, potentially accelerating tissue damage in the pancreas. Studies suggest that regular caffeine consumption may elevate the risk of acute pancreatitis and interfere with insulin production by reducing its effectiveness. This is particularly concerning for individuals with diabetes or those who are at risk of developing the condition. Since the pancreas is responsible for digesting nutrients, any disruption in its function due to caffeine can impair the absorption of fats and proteins. This may lead to digestive issues, reduced energy levels, and a deficiency of essential nutrients. Individuals with pancreatitis, diabetes, or other pancreatic disorders should consider limiting or avoiding caffeine to reduce the risk of complications and support the health of the pancreas. It is advisable to consult a doctor before making dietary changes. Number 7, gallstone disease. Gallstone disease is characterized by the formation of stones in the gallbladder, which can cause pain, inflammation, and digestive issues. Caffeine stimulates bile release, which may trigger the movement of gallstones, leading to pain, blockage of bile ducts, and even acute cholecystitis. If a stone obstructs the bile duct, it can result in pancreatitis and other serious complications. According to a study by the American Gastroenterological Association in 2023, caffeine increases the risk of gallbladder attacks and impairs fat digestion due to disrupted bile flow. This can lead to bloating, abdominal pain, diarrhea, and reduced absorption of fat-soluble vitamins. Caffeine also causes spasms in the smooth muscles of the bile ducts, increasing pressure inside the gallbladder and worsening inflammation. For individuals with chronic cholecystitis, coffee may trigger frequent flare-ups. People with gallstone disease are advised to avoid caffeine, especially if they experience acute symptoms. Consulting a doctor to create a safe diet plan can help reduce the risk of complications. Number 8, digestive issues. Caffeine can worsen gastrointestinal conditions such as gastroesophageal reflux disease, irritable bowel syndrome, gastritis, and peptic ulcers. It increases stomach acid production and weakens the lower esophageal sphincter, raising the risk of acid reflux and heartburn. According to a study by the American College of Gastroenterology in 2023, regular coffee consumption increases the frequency of gastroesophageal reflux disease symptoms and may slow the healing of ulcers. In individuals with irritable bowel syndrome, caffeine stimulates intestinal contractions, leading to cramps, diarrhea, and abdominal pain. Coffee also irritates the stomach lining and can intensify inflammation in people with gastritis. Its acidic properties may worsen symptoms in those with peptic ulcers. Research from the National Institute of Diabetes and Digestive and Kidney Diseases in 2024 found that caffeine can slow the recovery of the stomach lining and aggravate symptoms of indigestion. Individuals with digestive disorders are advised to limit or avoid coffee, especially on an empty stomach, and consider switching to less irritating beverages. Before making dietary changes, it is important to consult a doctor. Number 9, respiratory system issues. Caffeine stimulates the nervous system, which can lead to faster breathing and increased strain on the lungs, especially in individuals with asthma and chronic obstructive pulmonary disease. According to a study by the American Association of Pulmonologists in 2023, caffeine may worsen airway inflammation in people with chronic lung conditions, triggering wheezing, shortness of breath, and coughing episodes. Caffeine also has a diuretic effect, which can contribute to dehydration and thickening of mucus in the lungs, making it harder to clear phlegm. Additionally, caffeine increases cortisol levels, which can weaken the immune system and intensify inflammation in the airways. Research from the European Respiratory Society in 2024 suggests that regular caffeine consumption may worsen asthma symptoms in sensitive individuals by causing bronchial constriction. People with lung conditions are advised to limit coffee intake, stay well hydrated, and opt for herbal teas to reduce strain on the respiratory system and lower the risk of complications. Number 10, bone health issues. Caffeine can negatively impact bone density by reducing the absorption of calcium and magnesium, which are essential for bone formation and strength. It also increases calcium excretion through urine, raising the risk of osteoporosis and fractures, especially in older adults and postmenopausal women who naturally experience bone loss. According to a study by the National Institutes of Health in 2024, caffeine may interfere with vitamin D metabolism, reducing its ability to enhance calcium absorption. A deficiency of this vitamin accelerates bone loss and weakens the skeletal structure. Additionally, caffeine raises cortisol levels, which can break down bone tissue and slow down its regeneration. Research has also found that elevated levels of parathyroid hormone, triggered by caffeine consumption, may cause calcium to be released from bones, making them more fragile. This is particularly concerning for individuals who already have bone-related conditions. People with osteoporosis, osteopenia, or weakened bones are advised to limit caffeine intake, increase their calcium and vitamin D consumption through diet or supplements, and switch to caffeine-free alternatives to support bone health. Before making dietary changes, it is best to consult a doctor to prevent bone loss and reduce the risk of fractures. What do you think about this? If you have any questions, feel free to ask in the comments. Next, I recommend checking out these videos, and don't forget to leave your likes and comments. I'm looking forward to them.